so appreciate that. All right, so next we have a really great speaker who is going to help us figure out how we leverage federal funds and resources, which is something we've talked a lot about over the last 2 days. And so I'm going to introduce Charlie Smith, who is the Regional Administrator for SAMHSA, which is the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services, Region 8, which covers Colorado and a number of other states. He is also a licensed psychologist with over 30 years of experience and has an incredibly collaborative approach, and I can attest to that. He's been a great partner, so let's welcome Charlie Smith.
Thank you very much. Can you guys hear me okay? And are you guys running slides?
No, you got a clicker.
Oh, I have a clicker. That's even more dangerous. Let's make sure a clicker works. There we go. Great. So thank you for allowing me to join all of you. And as much as you heard earlier from Souther Cole talking about who has the money, I guess that may apply to me as well, since I get to talk about federal resources that are coming here to the state. So as indicated, my name is Dr. Charlie Smith. I'm the Regional Administrator for SAMHSA, which is the Substance Abuse and Mental Health Services Administration. SAMHSA serves as a lead federal authority for mental health and substance use for the country, and it crosses the age continuum from birth to death, as well as the service spectrum, so prevention, treatment, and recovery. In my capacity, I serve as the lead federal authority for mental health and substance use for Region 8. This is Region 8, so it includes Colorado, Montana, North and South Dakota, Utah, and Wyoming, and 33 tribal nations within that territory, and as I frequently say, by far the best region in the country. But we do have a challenge, and I think that it really kind of speaks to the Attorney General's and all of your commitment to addressing the issue of substances, and specifically opioids, and coming together and kind of really take a deep dive look at this. Clearly, the federal government is a partner with you in this work. This is not a new partnership. I think, if anything, really want to galvanize the long-standing partnership that the federal government, specifically SAMHSA, has had with Colorado, in that Colorado has been a leader in the area of addiction treatment, in the area of addiction prevention work, as well as in the area of addiction recovery. So I'm happy to kind of walk through some of this, and this is short, and this is not a deep dive into SAMHSA, but at least will give you some intersections of where SAMHSA can be a partner in your work at the county and jurisdictional level. So very quickly, as a glance, SAMHSA is an agency. We've been around. This is our 30th year. We serve really as to address the impact of substance use and mental illness on America's communities. That's our tagline in the middle, and I really want to emphasize, as much as behavioral health is essential to health, health is essential to behavioral health. There have been a couple of references that we have to think about this as a polydirectional relationship, not a unidirectional relationship. That carries over very well when we talk with communities and families and individuals. We also know that prevention works. We also know that treatment is effective and people recover. There's evidence to show that the treatment for addiction is more effective than the treatment for diabetes and asthma. But we don't talk about it that way. So if we think about relapse rates as being lower for individuals with addiction and substance use disorders than our other chronic illnesses, we have to right-size that. SAMHSA has 5 core principles, which I'll talk about here in a moment, but I think most importantly, we've had a budget of around $6.6 billion. That's substantial. Bear in mind, Medicaid and Medicare's budget is $1.7 trillion. So we're small in the scheme of things, and when we think about healthcare, and particularly behavioral health, the majority of behavioral health care is funded by Medicaid and Medicare. Less so by some of the funds that come from SAMHSA that serve within your state as a way of kind of filling some of those treatment and financial gaps. However, what's notable is that this past year and a half has been an enormous attention to behavioral health, addiction, and mental health by the federal government, so much so that SAMHSA's budget has almost tripled. And we're looking to see this commitment continue forward with a tremendous amount of support, not only from Congress, but also the Biden-Harris administration. That is substantial. In my 30 years of doing this work, I've never seen this degree of investment, and clearly Colorado is taking major advantage of that, and that's a huge bonus. Our organization, I will not go into terribly deep, but I think most importantly, which I'll highlight, we have a center of excellence inside the federal government focused on substance abuse prevention, a separate one, substance abuse treatment, and then finally, this year, we are, for the first time ever, opening an Office of Recovery. So within SAMHSA, highlighting the importance of recovery and thinking about all aspects of recovery, not only at the end of treatment or towards the latter stages of treatment, but thinking about recovery as cyclical. It's something that we're always thinking about supporting individuals and families through their entire lifespan. And then finally, really at the core of what SAMHSA does, we're leadership and voice. We do funding, we do data, we do a lot of training and practice improvement. I do not have a slide on here, but we have technical assistance centers, centers of excellence for addiction treatment, addiction recovery, and prevention in this region alone, as well as across the country, that are all free. Training officers, training staff, training clinician, training administrators, training county officials about issues of addiction, substance use, and how to kind of build that into that infrastructure that you are looking to capitalize on. We have resources available for you for free. SAMHSA's priorities, I'm not going to go through all of them, but you'll see our first priority is addressing opioid overdose and even more broadly substance use. That is something that's carrying over, and the fact that we've lost over 100,000 individuals this past year to overdose. That's very different than 80,000 2 years ago, and that's very different than 60,000 6 years ago. That's going in the wrong direction. Our commitment is staying strong, and again, it's not a unique SAMHSA issue. So this is actually coming across Secretary Javier Becerra, the Secretary for HHS. He is seeing this as a cross-federal government initiative where SAMHSA is playing a key role. One of the things that I do want to emphasize in here, a couple of things that I've picked up in some of the commentary. When we want to think about addiction treatment, you want to think about integrated care. We want to think about addressing the needs for substance use across the entire healthcare curriculum and continuum, rather than assuming mental health and substance abuse is something separate from physical health care. And to make sure that within your communities, there's opportunities and investments to make sure that primary care, specialty care are interlacing with mental health and substance use. We're very focused, as I mentioned, on workforce. It was talked about earlier. We have a workforce shortage across the country. It's not unique to Colorado. But there are many strategies that some are actually noted that we can start looking at, and there are resources within SAMHSA. I want to highlight SAMHSA's Center for Substance Abuse Treatment, CSAT. This describes the mission. Clearly, our priorities are focusing on the opioid crisis, as well as advancing prevention, treatment, and recovery. Program areas that are important that funnel from us to the state and oftentimes directly to your local community mental health centers, substance use treatment programs, and other community-based organizations. Those include state block grant dollars, which I'll talk more about here in a moment. The state opioid response dollars, which I'm sure many of you are familiar with. Those emanate from Congress through SAMHSA to the state. In addition, there are tribal opioid response dollars that go to our 2 tribes here in southwest Colorado. Additionally, we provide competitive or discretionary grant programs, which I'll make note of here. And then we also are the regulatory oversight for the country for opioid treatment programs. Essentially, those are the programs here in Colorado, I believe around 19, that provide methadone for the treatment of opioid addiction. In addition, we oversee the specialized training alongside the DEA for physicians and nurse practitioners to prescribe medication for the treatment of opioids. That's the Data 2000 waiver program. Here's an example of SAMHSA's portfolio for opioids. I focus in on grant programs, and this gives you the majority of them, if not all of them. I want to start with the Substance Abuse Prevention and Treatment Block Grant. That's a block grant that comes to the state. It goes through Dr. Medlock's office, the Behavioral Health Authority, formerly the Office of Behavioral Health. That block grant is the backbone for substance use services here in Colorado. It can pay for prevention and also pay for treatment services. I'll show you a breakdown of how much that is here in a moment. State opioid response dollars, and then we have a number of competitive grants, which include opioid recovery centers, prevention, pilot programs for the treatment of women who are pregnant and postpartum, first responder programs, as well as talking about integrated care. We are funding nationally over 1,000 sites, what are known as certified community behavioral health centers. We have a number of publications, all of which are free. Our website, www.samhsa.gov, has all of this information on there. I believe our app is coming back online, an MAT app. And most notably, we've actually been holding very true to the opioid overdose toolkit, really as the backbone or the Bible of a lot of this initial work. And then I mentioned these technical assistance centers. There's an opioid response network, which is based at the American Academy of Addiction Psychiatry, however, has nodes across the country. One of those nodes is here at the University of North Dakota that serves Colorado. Free consultative resources for your communities, for your providers concerning opioids. And then so those are some of the other examples of TA centers available to all of you. This is Colorado's current portfolio from SAMHSA. So SAMHSA currently invests over $180 million in the state of Colorado this year. Now, the majority of this actually goes through your Behavioral Health Authority. As I mentioned, the Substance Abuse Prevention and Treatment Block Grant's around $47 million. When I was the state director here, that block grant was around $20 million. So this is a substantial change in the last 10 years, and to see this as an opportunity for all of you to braid your activities with the opioid settlement dollars, to think uniquely about your needs within your community, to buttress them and connect them to what the state is doing. There's additional, obviously, this lays out all of the investments from SAMHSA, including mental health, and yes, SAMHSA is bifurcated. We have a mental health section and a substance abuse section, but it gives you a sense of where that investments are actually coming from. The state opioid response is another $20 million, which gives you, as a state and communities, great flexibility to address prevention, treatment, as well as recovery, to focus on harm reduction initiatives. And then on the right-hand side gives you a sense of discretionary grants, and those are communities and programs in Colorado that have actually applied for and been awarded SAMHSA funding to actually support their local initiatives. To give you a sense of the state opioid response grants, this is a national view, not a Colorado view. But it gives you a sense of how many people received services across the country, just shy of 1 million in 1 year. Just shy of 700,000 received recovery supports, and you can actually see the number of overdose reversals that actually have been calculated according to the state opioid response dollars. Making major investments nationally. Colorado's in this mix and equally contributing to this great work. One thing of note, the state opioid response dollars, when it was passed, was a 10-year amount of funding. This is year 7. So we have 3 more years of state opioid response grants coming through SAMHSA unless Congress takes action. That is an opportunity, I think, for us within SAMHSA, but clearly within the state and all of you, to help think about how do we kind of keep this investment going forward through, obviously, your legislative connections and through our executive branch. Again, it's a 10-year overall funding. We're at year 7. I mentioned the Data 2000 waivers. This gives you or actually opioid treatment programs. This gives you a national look. Colorado's right there in light blue, where we have 30 opioid treatment programs in the state. SAMHSA oversees these opioid treatment programs alongside your Behavioral Health Administration, in which there is a state opioid treatment authority, SOTA. SAMHSA and the state work conjunctively with regard to the delivery of opioid treatment programs, and we look to monitor that. Within this slide, there's also a reference to the Data 2000 waiver training, where we review, along with the DEA, all of those providers who are actually allowed to prescribe buprenorphine, Suboxone for the treatment of opioids. And we work very closely, provide free training, as well as to support that infrastructure, of which Colorado actually has a very robust investment. I do not have the data today on Colorado's number of DEA, Data 2000 waiver providers, but I do have that if you're so interested. I do not have it broken down by county, though. And then the last thing I really want to emphasize, I'm happy to take questions, is that frequently we talk about opioids and substance use disorders in isolation. And I really want to emphasize, and I think that this graph, which is part of our National Survey in Drug Use and Health, which is the largest prevalence and service utilization database and annual survey that's done by SAMHSA for mental health and substance use, is to look at the intersection between mental illness and substance use. There's a substantial number of individuals who struggle with both. And as healthcare practitioners, I believe it's imperative that our healthcare systems need to be looking at the whole individual rather than just seeing somebody struggling with addiction and forgetting the fact that there may be trauma, there may be depression, there may be significant psychiatric disruption. And likewise, to assume somebody with psychiatric disruption, trauma, depression is not struggling with addiction. So we really need, as a system, and I think our prevention, treatment, and recovery systems, communities need to think about the whole person as well. And just wanted to kind of flag this for today's conversation. So with that, let me go ahead and end. Maybe I'm getting us back on track or timing, but I'm happy to take any questions that you may all have. Wow, I lulled you to sleep. Is this like post-lunch? Yeah, sure.
Yeah, and I do just want to let people know, I think some people might have walked out because of our networking session, that we've just changed the schedule just slightly. So we've pushed back the networking break, so you're still getting a break, just so you know. So don't walk out thinking you're not getting a break. You are still getting a break. So we maybe have time for 1 or 2 questions.
Charlie, I just wanted to ask you if, when we were talking in the hall, you were saying, hey, I have free consultation on all these funding. So how do people learn more? I mean, to just get onto this? As someone who's a very small nonprofit,
Sure.
How do I connect and start learning how we can access these funds to provide services?
So Carol, happy to help. So you're welcome to contact me directly. And I realize there was not a closing slide, but I'm based here in Denver, and this is home. So I'm here to support you and your efforts and anyone here. In addition, SAMHSA actually has been hosting now for the past year a number of kind of open showcases and opportunities for smaller community-based organizations to come together to kind of share ideas, share opportunities, and also to leverage not only SAMHSA dollars, but other federal dollars to actually meet your mission, meet your program, meet your objectives. As well as we're positioned to support you as counties and to connect a small organization with a county initiative, with a hospital initiative, and to see where those intersections and synergies are. So you're welcome to contact me directly or actually go through SAMHSA's website.
That was my question, too.
Yep.
And I'll add something to that. So I'm Jose Esquivel. I'm director of the Colorado Consortium for Prescription Drug Abuse Prevention. And one of the other ways that we work with Charlie and others is through the consortium, we track the federal funding announcements that are coming out that would be useful for. Whoops, oh, there we go. But we have a grant writing assistance program that I hope a few folks have made use of through the consortium. But I think in coordination with the AG's office and the COAC, we can make sure that when those announcements come out, we coordinate that so that we get that information out to you all. So not only for the COAC to think about, but even for those of you that run individual nonprofits, if you're eligible, then we can get that information to you through our network and then potentially offer you the grant writing assistance to help even write for these federal grants. Okay.
And the last thing I'll note is, so I co-chair a regional substance use consultation team, 25 federal agencies. We have a listserv of over 1,000 individuals. We offer free quarterly webinars on a variety of topics, all of which are archived. If you want to join that group, any one of you, just let me know. And again, we put out a monthly newsletter about new grant opportunities. As Jose indicated, oftentimes he's stealing what I'm putting out there, which is perfect. But the idea is really trying to broadcast as much as we can, but also appreciate, we have a budget, we have a commitment, but we know that if we can get the big dogs, if you will, the CMS, the Department of Labor, U.S. Department of Agriculture, for those of you in rural, remote communities, use USDA. We can actually help you connect to USDA. We talked about, I heard a note earlier about 6 hours to get to treatment programs. We have 14 hours to get to treatment programs in Montana to North Dakota. We have USDA funding the first North Dakota, South Dakota, Montana tribal SUD treatment program fully funded by USDA. Breaks ground next month. That type of partnership where SAMHSA is able to come in with some workforce and treatment dollars, but facility build out is done by USDA, is one of those unique partnerships. And so if there are ways in which you can then leverage your connection and partnership with the feds, if using me is the job, use me to really get what you need. So happy to do that.
Great. Thank you so much, Charlie. Dr. Smith, each presenter here could be an hour and a half, providing so much helpful information and doing this work for many years. I think over 30 years as licensed practitioners. So just for you all to know that are new in this realm, that there are resources like Charlie, like others, like Amy Cooper, who leads the SOR State Opioid Response Grant that we heard yesterday. There are resources that if you're starting out and don't know who to turn to, feel free to reach out to any of these folks or to the various external relations from the Colorado Consortium as well to help navigate the complicated web of braided funding. So we will now give you actually a 10-minute break before we return for our treatment panel, but wanted to just again say a huge appreciation to you, Dr. Smith.